I'm Dr. Arash Hakhamian, the modern dentist, with another episode of Dental Heroes, where we bring you some of the most incredible dentists, providers, clinicians who are inspiring and changing lives, not only of their patients, but in all of dentistry. And today we have an amazing pediatric dentist, Dr. Pooyan Nasibi. Dr. Nasibi, thank you so much for joining me today. I'm so excited about talking to you.
Thank you for having me. It's a pleasure to be here.
Good, good. So, Dr. Nasibi, I know you come from a family of dentists, right? Your brother, cousins. It's very interesting. Like my own family, I'm starting to see other families who have multiple clinicians. So, tell me a little bit about your family and what you guys do, how you're involved in dentistry.
It's a big blessing to have a big family that's actually involved in the same field that you are a part of. So, having great mentors in the field has allowed me to become a much more well rounded provider, not just to my patient, but to my staff, and to be a part of an integral part of a community. So, it's been a very major blessing. My oldest brother he's an orthodontist. His wife is a dentist. A few of my cousins are oral surgeons, general dentists. So it's been a long family trade, it seems.
So it's safe to say dentistry runs in your blood.
It sure does.
Okay, great. So it's incredible. My father, brother, sister,
Of
all,
course.
all involved in dentistry as well, and it's really interesting because for us, it's not a business; it's a way of life almost, and I see a lot of that in you.
Absolutely. I couldn't agree more. Very well said.
So was it family pressure or just the love of dentistry? Like, what inspired you to become a dentist?
Wow. To answer, that's a beautiful question. What inspired me to become a dentist? So there's so many different aspects of dentistry that pulled me towards dentistry. One of the many was the scientific background of it. As a kid, I always enjoyed painting, drawing. So it was just something, the fusion of both, it just became something that was a calling for me. And knowing that I could provide people with beautiful smiles, help them, oral cavity just is such a big introduction to the whole systemic body. And having that fused together, it just allowed for me to find my love for dentistry.
That's amazing. So just for our audience to be clear, what you have not only become a general dentist, so you can do pretty much what any other dentist can do, but in addition to that, you actually went for a couple of years and got additional schooling to be able to really specialize in delivering, the best class care to pediatric patients, to children, right?
Absolutely. So did my dentistry at University of Southern California, otherwise known as USC, and once I graduated, went directly into a residency at Loma Linda, which was for advanced pediatric dentistry. And it gave me a great insight as to what it's like to be a specialist, to deal with children, and how to manage them, be able to provide proper care, the quality care that they need, how to be passionate, how to be, what's the word I'm looking for? How to be complete,
Comprehensive.
exactly, there you go, a comprehensive provider for children where you could tap into their psyche, make them feel welcome, make them feel uh, at ease and relaxed while you do dentistry for them. Because as you know, most of our traumas come from childhood. And if you're able to catch that early on in life, then children don't need to go through the fear of dentistry. If they have a dental home where they could feel safe at and the treatment they need is met on time. So it helps a lot.
Yeah, it really sets the tone, I think, for their entire life.
Absolutely.
If I think that's probably the most important. I would say out of all the specialties, and I dare say is, I think pediatric dentistry is probably the most important, and I'll tell you why. I think if you set the tone early, if you start acclimating your patients early on with proper oral hygiene, without the fear of going into the dentist, showing them that this is actually could be a pleasant place. Now it's crazy, right? Most people don't have a pleasant experience with the dental office, but I think that all goes back to when they were children and they weren't properly introduced and educated, informed on how to have good oral health for the rest of their life. So I think specialists like yourselves are really going to set the tone from an early age and ensure a lifelong of success at the dentist.
Absolutely. I couldn't agree more. Just having patients it's like even infants coming in at early age, getting them desensitized to the dentist, understanding there's a difference between a medical provider and their dental provider. So being able to not freak out coming in thinking they're going to get shots every time. So
Right.
it's a blessing. So being able to have a pediatric dental office near you, any parent could take advantage of that, getting their children to feel safe and at ease. And once there is, God forbid, an emergency, then they know that they're safe. Where they're coming, it's not a fear factor for them.
Yeah.
It's more of a home, a dental home where they can grow and get the care that they need.
I think most dentists who do general dentistry don't really have the time to sit there and nurture that relationship with, an infant. And so they tend to rush through some of these initial initial interactions, and that's when things start to go wrong. I think certain things are overlooked, and then it's a slippery slope from there. So I think what you're doing is important. Now, tell me, what do you do in your office? I know you have a special. Every hero has a sidekick. Who's your sidekick, and what are some of the interesting things you do in your office
Of course.
to make your patients feel at ease?
We definitely want to take every approach possible to get our patient to feel comfortable and at ease. And we're fortunate enough in our office, we have a therapy dog named Vader.
Where's the producer? Yes, can you bring Vader in?
Hey,
Thank you,
buddy.
thank you.
Hi, my love.
So
Hi.
who's this puppy?
So we have Mr. Vader here. He is our trusty handyman. He takes care of all of our patients with love. There's so many things I could talk about Vader about, but I can't even say enough. The way he treats our patients. So, for instance, coming to a dental office can be filled with anxiety for children, parents. So we figured having Vader's presence
He's
in our
so cute.
office would do wonders for him and for children. Let me go and give you this guy back.
He's so calm. So what do? You have like an emotional support dog. The kids play with the dog. You sit on their, the dog sits on their lap. Tell me about it.
So Vader, I'll have some couple of videos I'll show you guys just of what Vader does for our patient. So coming to a dental office, patients always feel anxious, majority of children, and they don't know what to expect. When they come in, they see Vader, it's completely a major distraction for them, where it puts them in a place where they feel comfortable. They no longer feel they're in a dental setting, and they're able to find common ground where they feel so, how do I put it? They feel so completely away from that dental setting. They feel
You're changing the whole environment,
so
right?
it
The
is
whole setting.
exactly.
Yeah.
Once the environment changes, the attitude changes. The patient, so we have patients that don't even want to come in unless Vader is there.
Yeah.
Their parents call us in advance. They're asking, "Is Vader going to be in today? If not, my kids said he's not going to go to the dentist."
That's so cute.
Yeah, it's an amazing blessing. Vader he's a very calm dog, very relaxed, very doesn't ever bark. So when children come into him, he's actually been able to help few children that have a phobia of dogs to get over it and be able to feel just so comfortable with them. Now parents are like, "That we bought a dog because of Vader."
That's amazing.
Yeah, so it's been a
So Vader's at the office every day, calming down patients, playing around with the kids.
absolutely, yeah. He's been doing just wonderful. So he comes into treatment. He never comes inside the actual treatment room, but when we're doing consultation with parents, he comes in there. He says hello to the kiddos, parents,
Wow.
our staff, myself included. He is just all around love, pure love, and that energy gets transferred to our patient. They start feeling so much more relaxed, and whatever it is that we need to communicate is heard on a different level. Once those
Amazing.
children are at ease, parents are at ease, so we're able to have open channel of communication, and the points that we want to convey to parents or the patient is heard much more clear.
That's amazing. So how much does Vader get paid? Well, your best paid employee.
That's right.
Yeah. So tell me about the patients who have extreme anxiety, and just are so fearful that you can't really treat them. I remember when I was growing up in my father's era, I remember that they would actually tie kids down to chairs. They had something called a papoose board, And so if, you're working in a patient's mouth and the baby's just young, and just not babies, I think they were all the way up to 7, 8, 9, 10 years old. Dentists would literally tie down patients and not let them move their head, put something inside their mouth so they can't close. And it was very barbaric. Tell me, how has that evolved and how do you make sure the patients are comfortable?
So as a pediatric dentist, papoose board, it's something that does get used from time to time, but the indication isn't the way that it was used before. Previously, it was just they bring the kid in, tie him up, wrap him up, go to town on the child, do a roundhouse dentistry. We're completely against that because the psyche that it gets really traumatized, gets impacted for the worse. And that's where the children lose their trust and mistrust with dentistry unfortunately comes to fruition. So what we like to do is intercept that. So there is different modalities of dentistry where we're able to provide quality care where the child is not traumatized. So one, obviously, there's minimal sedation, which includes nitrous oxide. We have a little bit more advanced, which is moderate sedation, which was previously known as conscious sedation,
Mhm.
which we give a liquid in combination to nitrous oxide, where these children become anterograde amnesia, which means once they drink the medication, 15, 20 minutes later or so, they pretty much forget about anything that transpires for the hour and a half period following.
Wow.
So we're able to get the children feel a lot more safe, comfortable, at ease, and be able to provide the dentistry that they need.
Wow.
And unfortunately, that's not always a case that we can provide oral conscious sedation either to physiological abnormalities or some sort of medical concern that we want to avoid. So we have general anesthesia where we're able to completely put the patient under and do the work that's necessary for them.
That's incredible. So you have different options now from oral sedation to nitrous all the way down to general sedation. So either the patient can be completely sleeping or you essentially give them some sleepy juice so you can do your work and they forget what happened. So they're not leaving with trauma.
Absolutely. So that's one of our biggest things as pediatric dentistry. It's not just doing the work, but how we perform that work, how we're able to connect with our
Right.
patient, how we're able to help them feel so much trust and comfort and try to avoid that. So one of my biggest thing that I love about my profession is seeing children coming there scared and then leaving happy, knowing that they're in a safe environment, knowing that the dentist is actually their friend, not their enemy. Because, unfortunately in our culture, we have adopted saying like it's like pulling a tooth. So we inherently have believed that dentistry is something that's negative. And our job as pediatric dentists is to change that. I actually let them know that we're here to help them. And if we weren't there, there'd be a lot more issues rather than less. But again, it's not about what we do, it's how we do it.
Correct.
So,
Correct. So I want to ask you on that question for our audience, what are some of the common mistakes that parents make in basically with dentistry or addressing or things that they say that they shouldn't say. So one of the examples is like threatening their baby, like if you don't brush your teeth, I'm gonna take you to the dentist. And so they automatically are afraid of going to the dentist. So tell me, as a pediatric dentist, what are the common mistakes that you see parents make?
so to what you were saying, so one of the most notorious lines is if you don't do what is brush your teeth, I'm going to take you to the dentist who's going to give you a shot. So they automatically putting the fear into a child. And some of the other things that we tend to see, some parents themselves have phobia of dentistry. And unfortunately, they translate that fear into to their children. So
Mhm.
another thing is when they walk in, they talk about the behavior they don't want to see, like, oh, he's nervous. So what we would like for parents to do, try to create positive reinforcement, start using euphemistic language rather than making the dentist the enemy, make the dentist your friend. Just like how children look forward to the tooth fairy when they lose their teeth. They're not
Amazing.
worried about losing the teeth because they're talking about the tooth fairy. So it's a positive experience. We want to kind of take that analogy and utilize it within the dental field. So when parents are able to communicate with their children, don't have the dentist as an enemy or as someone that's an enforcer, more as someone
Mhm.
that's their friend, that's there to help them. And in case they do get cavities, we're there to help them get through that.
Amazing. So tell me some common mistakes outside of the verbiage and the language. One of the things I heard is like making sure parents and family members don't kiss the baby, and that they watch out what they put inside their mouth and the baby's mouth, because that can actually affect really their oral microbiome, and that they can set the tone for the rest of their lives.
Absolutely. So, as you know, and I'm not sure if our audience know or not, dental caries is actually contagious, and the bacteria that we have do to transfer from within our own mouth from one tooth to the next tooth, or it can go from one person to the next. So if a parent has cavities and they kiss their child, they can transfer that. One of the most common route is called horizontal, which is from the mother directly to the child. When the child is born, they pass their bad bacteria into the child. And as you mentioned earlier, sharing bottles, pacifiers, or toys, or anything of that nature, if they're in a communal setting, they pass that around. If one kid has any sort of bacteria, that can get passed around. And dental cavity is not the only concern. Sometimes we're more worried about herpes complex or
Wow.
other different type of viruses and bacteria.
That's incredible. So mind-blowing to many patients when you tell them that you catch cavities. And so you mentioned there's vertical transmission, which is from the mother to the child, and then horizontal, which is from one person to another. So that's crazy. So someone passes on the cavity uh the cavity bacteria to the cut children. Like, is it true that if that baby never gets the cavity causing bacteria, it's contagious, it's passed on, essentially they can never have cavities, but at some point someone's going to kiss that baby, or some type of saliva transmission is going to then give them the bacteria? Is that how it works?
That is exactly correct.
Okay. So what do you recommend? Don't ever kiss your baby?
No, of course not. I mean, we definitely want to be emotional, and we want to comfort our children. We want to be nurturing to them, but it's just you want to make sure that the parent is cavity free before, if they can, before getting pregnant, see the dentist, make
Mm.
sure that they get rid of all the cavity that they have inside their mouth and try to keep their oral biome as healthy as possible. And there's been studies about xylitol usage during pregnancy that could actually get rid of these cavities.
Oh my God. So it actually starts from pregnancy.
Absolutely, pre-pregnancy, right?
Pre-pregnancy.
Because once you're pregnant, you obviously want to avoid dental needs unless it's absolutely necessary. So before getting pregnant, if it's a possibility, you want to make sure encourage parents, both of course mothers more so than the father, to make sure they have their teeth dental needs met.
So okay. So you have your baby. Hopefully, while you're pregnant, you don't need major restorative work, but you want to have a clean mouth. Your cleanings are important. Sometimes patients get pregnancy gingivitis, inflammation. So let's assume that the mother has excellent oral health, baby is born healthy. Um, we want to refrain from sharing different types of eating utensils. We want to make sure family members don't have a habit of kissing our baby on the mouths.
Absolutely.
So what happens? We spoke to a microbiologist, Dr. Emily Stein, who said basically the microbiome in children is set from birth till about 3 years. And so that's going to really determine for the rest of their life their microbiome and how their oral health and then their overall health is affected. So when should someone bring their baby to the dentist? Well, do they wait for teeth to come out when they're born? At what point is it important for parents to take their children to the dentist?
We usually would like them to come in within 6 months of the first teeth erupting, or within 1 year of age of life. So basically, the first dental visit, of course, it's important for the child to come get introduced to the dentist, get desensitized as much as possible. However, I believe that first dental visit is most important for the parent.
Mm.
The education that they're able to receive, the anticipatory guidance that we can guide them through to learn about, and to do's and don'ts of dentistry, of how to provide proper oral hygiene care for their children, what food are good for them. Early childhood caries, I believe, it's the number one disease affecting children.
Wow.
So we want to make sure that we're able to give them an understanding of how the sugar process work, how cavities come about, and how we can prevent that. And that one of the best ways to keep children happy at the dentist is by not preventing them from having cavities. And that only comes from the education that's provided by the dentist to the parent.
So the first couple of appointments is more educating the parents on the do's and don'ts, the same way they go to other practitioners for, I don't know, mommy and me classes, all types of that. The same thing at the dentist.
Absolutely.
Okay. And because they're going in early, they are not having to do invasive procedures. So those first couple of experiences are more of a relaxed setting.
Absolutely. And then the child gets more comfortable with the dental setting and what we're able to, and then they start realizing, hey, maybe this is not such a bad place. Hey, I come over here, they brush my teeth, and that's it. And that becomes a more of an ongoing situation between the child and the dentist in the dental office, and they become more accustomed and acclimated into the office setting, and that fear factor just
Yeah.
goes out the door.
So what are some of actual issues that you also find in infants? So sometimes I see infants that are born with teeth,
Right, natal teeth.
natal teeth. Like, tell us about that. What are the dangers? How do you check for that?
So usually, if a child is born at with teeth at the hospital, they'll let them know for the parent to go seek dental care. But that's not always the case. You also have neonatal teeth, which the teeth can erupt within 30 days of life.
Wow.
So it's sometimes the tooth bud is not positioned where it needs to be. It sits a little bit higher than it's supposed to be on a dental ridge, and it pops out early. These teeth, if as long as they're not mobile or not causing infection and it's not causing problem with lactation, we tend to let them be monitored them. However, they can become very dangerous for a newborn. Why? It becomes an aspiration risk. If these teeth are mobile, they eat something hard or they touch it, or during breastfeeding, it could just pop out, or bottle feeding. The trauma itself could cause the tooth to fall out. And these children don't know at infancy that we're unable to swallow properly. And it could become a big, big risk factor,
So what you're
a
saying is,
choking hazard.
so that's what I was going to say. Some of these, teeth that are maybe there at birth or they appear within 30 days, they don't have proper roots. So they
Exactly.
could easily become mobile and you can inhale it and it can go inside the lungs.
Exactly.
Wow.
It becomes a very, very complicated situation.
And then also I hear that there's children that are born with like tongue ties and and they would go to a pediatric dentist who would then release that. How does that work exactly?
So tongue tie is actually a big phenomena that's getting a lot more attention in the recent years, and it has multifactorial problems that it creates for a child, as simple as having problem breastfeeding or bottle usage. It could affect phonetics. It could affect the way we sleep, the way we swallow, or, mouth breathing. There's just so many different factors that it seems to be associated within that tongue tie realm. So coming to a dentist, a pediatric dentist, or anyone who specializes in that, it would be a great service for a child if we are able to catch it early on, because it's easier to manage it rather than when they have their teeth in. It becomes a lot harder because the post-op care, it's very important so we don't get reattachment of the tissue. So to be able to take your child to a dentist even at an earlier age, if you have suspicion of a tongue tie or if been told by a tongue tie specialist or a lactation specialist, they can refer them to a specialist, and such as myself, where we're able to get in there and release these tongue ties.
So you literally will release the tissue and that's it, problem solved.
Absolutely. Just
Okay.
so what a tongue tie is an additional fascia that was supposed to break itself down through, but unfortunately it did not do so in a proper way. So it holds the tongue down and it doesn't allow the tongue to sit in this proper position where we need it to be, which helps a lot for swallowing, breastfeeding, and that's why a lot of children have issues.
And speech development.
Speech development,
Yeah.
of course, and postural development,
Wow.
and they're even going about, if they're unable to chew their food properly,
Wow.
it leads to constipation and other issues.
So okay, so you bring your infant in within a few months, check for potential teeth, check for tongue tie. look at the palate, look at the jaw development.
Absolutely.
And then one of the things I'm amazed by is the lack of understanding of what to give your kids early on. So one of the things that I think we've all seen is baby bottle tooth decay. So parents who uh, give their, everyone thinks you're supposed to give your baby a baby bottle with milk in it, and that the milk puts them to sleep. What does that do? What do you recommend? Is that the right thing? I've even heard of people putting in Coca-Cola sometimes and sodas. Is that something you see often? And tell us about the do's and don'ts.
Absolutely. So what you mentioned is now known as early childhood caries and or previously known as baby bottle syndrome.
Okay.
So we definitely do not want to put our children to sleep with the bottle because these when the milk sits on top of the teeth, it sits there, and every 15 minutes it starts a new sugar cycle and it starts attacking the teeth. These carcinogenic bacteria tend to produce lactic acid, and it tends to break down our teeth by the acidic byproducts. So what we want to do is try to interrupt that. If of course we need to feed our children, make sure they're growing and they're healthy. However, we want to make sure we get in there, brush those teeth, wipe them away, just to make sure that it's not an ongoing cycle after cycle after cycle, which ultimately leads to teeth decay.
So you're saying that when you put the baby to sleep, the milk from the bottle sits on the teeth, it causes acid production, and then that's how you get cavities.
Absolutely.
So is there something else you can put in the bottle to,
Water.
water?
Well,
That's
I
it?
mean, what we like to put in the water, I mean, I constantly hear, like you mentioned earlier, Coca-Cola or anything that has sugar in it. We genuinely want to refrain from that as much as
So
possible.
juice, no juice.
Absolutely no juice. And watered down juice is the same exact, gives you the same result, unfortunately, as regular juice or full
Mm.
concentration juice for that matter. The problem is it's when we introduce sugar into our body, it's not so much the amount of sugar, it's the exposure. How many times we get
Mm.
constant exposure into our mouth. So that's why diluting it, of course, it's good for diabetes and other systemic factors. However, when it translates into our teeth dentition, it's makes no difference.
Okay, so no leaving anything sugary or milk in bottles and giving it to the baby. It doesn't matter. And you said brush the teeth. How do you brush teeth? Do you do it with I've seen some of these brushes that they put over like a finger. What's the proper way to do that?
So those brushes are those fingertips that you're talking about predominantly better when they don't have their dentition out yet. It helps to cleaning the ridge and the farrow of our tongue. It's places where the same bacteria that cavities sit on our teeth sit out there. So we want
Mm,
to get into used to removing those as much as possible and desensitizing our children
mm,
before we actually introduce toothbrush into their mouth.
okay.
So, but once those teeth are in, we definitely want to start using a bristled toothbrush.
Okay. So you start brushing the baby teeth just like regular teeth.
Yes, and definitely we tend to brush them the same way, and we want them. So one of the biggest concern is fluoride that comes about. So do we use fluoride or don't we use fluoride? So fluoride is actually helps our teeth become much stronger and withstand much more acid attack. It actually takes our teeth from breaking down in 5.5 pH to 3.5. So once that composition of the tooth changes, it gives us much more um, strength to be able to combat acidic attacks.
Okay, so let's talk about the whole fluoride thing because it's very controversial, right? So there's two different ways that fluoride is used in helping prevent cavities. One is while the mother is still pregnant or during the early years of the infant, you actually want to, according to the science and literature, is to swallow and ingest the fluoride because then it goes inside the body and it actually gets incorporated into the tooth as the tooth is being developed.
Absolutely.
Correct?
It changes the composition from hydroxyapatite to fluorohydroxyapatite.
So this is ingestion.
Right.
But that once the teeth are formed essentially, then ingestion no longer is necessary. Now then we're talking about topical fluoride, which is in your toothpaste and your mouthwash, and that is just basically fighting acid attacks not from an internal standpoint, but from more of a superficial. Do I have that correct?
That is correct.
Okay. So, how do parents know how much fluoride to give their children and until what age?
Great question. So, Predominantly ages 0 to 3, so children don't have the same control over swallowing. So a lot of time they can't expectorate what they when we brush our teeth. So for that reason, we want to make sure we use a very, very small amount. You smear on top, like about a grain of a white rice size. You smear on top of the toothbrush, and you get in there and you start brushing the teeth away. Just with that contact, it gives the teeth the strength that they need to be able to withstand acid attack better.
Okay.
And then when they go from ages 3 to 5, we upgrade that to a green pea size. So,
Okay.
so the size is definitely a big issue. We want to make sure they're not swallowing too much so we don't upset their stomach
Correct.
or cause fluorosis.
So how much water, like how much fluoride needs to be in their water, like drinking water?
So that's a great question. You have to look into your city. Each state, each city, they have a different amount. But the parts per million, we definitely want to make sure we don't exceed a certain number. And the only way I could answer that question is knowing which city my patients live in or
Wow.
which city they're in. So it changes.
Well, that's incredible. So you actually, depending on where your patient is, you actually do the research and you ask them what type of water they're drinking, and you look into the amount of fluoride that the city water has. And then based on that, you give them recommendations on how much to supplement.
Absolutely.
Wow, that's incredible. So it's very customized treatment for each patient.
Absolutely. So that's why it's important to go through different questionnaires with our patients to understand them better, to understand what their needs are. Not one shoe doesn't fit, one sock doesn't fit everybody. So we want to make sure it's tailored and custom to each child.
Wow, that's amazing. So basically, my question is, and a lot of parents want to know, is like, who cares about these baby teeth? They're not permanent, right? They're just baby teeth. They're going to fall out. We're going to get the permanent ones. Like, it's okay. Like, what do you have to say to that?
It's a great question again. So when it comes to baby teeth, it's still a part of us. So if they do create issues, infection, it could go from local to a systemic problem.
Okay.
That's one of the biggest concern. And the other thing is as soon as we're born, our permanent dentition are starting to be built directly under these teeth. So if there is an infection, it can easily translate and go up into the permanent teeth and damage the permanent dentition that reside below them. And on top of that, if a child loses their teeth early, then they could have phonetic issues, TMJ issues, occlusion issues, need for crowding or space maintainers, which can translate to many years of orthodontic cares.
Okay. So before the show, you were telling me something really interesting that I thought was brilliant. I want to share with the audience. So you were saying that the permanent teeth, actually, the way that the permanent teeth develop is by eating the baby teeth, and it's the components of the baby teeth that actually end up being used for the permanent teeth. So if you lose a baby tooth early, you're going to have development problems of the permanent teeth, right? So what this is why I think is really equally important is like you have your baby teeth, and if you don't take care of your baby teeth, that is going to directly impact the permanent teeth.
Absolutely.
So what happens if you lose a baby tooth early and you want to keep the space open for the permanent teeth, right? Doesn't everything shift? So what do you do to keep the space open for the permanent teeth?
So as you mentioned, our teeth like to move. If there's no adjacent dentition to them, they either like to go towards the middle of our mouth, or if it's missing an opposing teeth, it likes to super erupt. It likes to come up. So what we like to do is preserve that space so we don't have occlusal issues or TMJ issues in the future. So we use different modalities of space maintainers. There's some for one tooth or multiple teeth. So just depending on what the patient needs, there are different appliances that could help secure that space to maintain it for the permanent dentition so it could erupt properly and come into its promised position.
So if something happens to a baby tooth and, whatever happens, you end up having to lose that tooth, or maybe the baby falls and has trauma, you don't just leave it. You will put something in there to hold the teeth in its position so that the permanent teeth have space to erupt in the right place.
Absolutely. Of
That's
course.
amazing.
We definitely want to make sure we prevent shift as much as possible, because even though it seems like it's negligible when it comes to those spaces, even a millimeter counts. I'm sure you can, you do a lot of cosmetic dentistry, so you're very familiar with how much one space, little bit of millimeter could affect the whole mouth.
And so you keep that space open until the permanent is ready to come out. And then at that point, you
But at
can
that point,
remove
we
the
go
space
ahead and
maintainer.
remove the spacer, allow for the tooth to have its natural eruption.
Okay. So one of the things I wanted to talk to you about is, you know, really focusing on prevention. And so one of the things that you were telling me that you do is you actually prevent cavities by sealing the areas where we have the highest rates of cavities. So talk to us because it seems like such a simple procedure. And I think parents should know that getting dental sealants and prevention is something that they can do. It doesn't require drilling, it doesn't require filling. Tell us about how you use dental sealants to prevent cavities.
Absolutely. So I'm going to quote Einstein, one of the great quote that he had that really resonated with me. It said, "Smart people solve problems, and genius prevent them."
Nice.
So, so we want to, of course, if what we can do is keys in prevention and dental sealant. So for teeth who have deep fissures and grooves and too much anatomy where bacteria and food could get trapped in there, we definitely always recommend sealant. Sealant obviously is a reversible procedure where we're able to just clean the tooth up and put a light white layer of dental sealant on top of it, which will allow for these bacteria to just slide off rather than getting stuck on top of our teeth. And yes, those are usually the first permanent molar. They come
Mm.
in the back, they have gum tissue a lot of time, trapping over it and just making it a perfect environment for these bacteria to flourish.
So some of the back teeth have these nooks and crannies, just, some of them have deep little fissures and pits and valleys. So you just basically put a material like a liquid that goes over and seals these,
Exactly.
and then you hit a blue light on it, and that's it. Voila.
That's
Easy.
simple as that.
That's
And
incredible.
that will prevent you, as long as it's well maintained, it will prevent the child from having to ever have to deal with these
Just
cavities.
imagine the amount of cavities you can prevent by sealing these teeth. That's incredible. So tell me about braces, right? I feel like it's a standard. Everyone just tells their patients, you need braces. How do you know when you need braces? At what age do you recommend braces? What could parents do to help avoid braces? Like, tell us about that whole orthodontic recommendations, preventions. When do you need, maybe even before braces, when do you need to do what they call phase one treatment to make sure that you avoid surgery, for example, in the future?
Absolutely. So when during our younger age, our bone haven't fully fused, so we can take advantage of that and allowing for fast. To answer your question about phase one orthodontics,
Hmm.
so for you and I, if we were to go ahead and get braces at this point, our bones have fused complete, so we're unable to get that proper movement that we like. So what we like to refer to that is what's the word I'm
The
looking for?
palatal
No,
expansion.
no, not power expansion. So we're actually getting pseudo movement because
Oh, wow.
our bone isn't moving, our teeth are moving instead. So, but when a child, for the child, we're actually doing orthodontic movement. We're actually able to open up the palatal, since the palatal fissure hasn't completely fused.
Fused.
We're able to get an expansion of that and get true orthodontic movement rather than compensatory movement of the teeth.
So it sounds like it's very similar to how like a baby's head is still very soft,
The fontanelles, yes.
right? They're still soft and they haven't fused together. So you're saying in the early stages, their palates are still soft and malleable as well, right?
Exactly.
So is this a time to expand and create more room? Like tell us about that.
So if a child, so each case is different, of course. If a child is in need of it because lack of space, this would be the ideal time to get in there and get those teeth to move. Sometimes with rapid palatal expanders, or there's different modalities. You're never too young to get your teeth corrected. I know there's some misnomers about that, but recent studies have shown that we want to actually attack this at a young age, earlier age, because it affects speech, it affects breathing, it affects so many different avenues. And there's been linked studies with lack of inadequate breathing has led to ADHD or ADDs or other issues that become behavioral issues. So we really want to make sure we're able to help our children hone in on this as soon as possible to be able to get the movement.
You know, it's crazy. The statistic I read a short while ago was that 55 million school hours are lost. 55 million school hours are lost due to dental emergencies with pediatric patients. Like, this can all be prevented. Imagine the amount of time they have to miss at school, and imagine the lack of focus that you were
Of
mentioning. Is
course.
if you are in pain, you're not focusing on your education. So they've they've almost seen a direct correlation between poor oral health and pain, and things like, and also the lack of ability to breathe, the lack of oxygen, and ADHD, as you mentioned.
Right. Unfortunately, it seems to be a troubling issue for our youth.
I think one of the most important things we can do for our children is to take them to a pediatric dentist and have the pediatric dentist evaluate the palate, the amount of tongue space, the way that their jaws are being developed, and start focusing on expansion early.
Absolutely. Positioning of the tongue plays a major, crucial role on the expansion of the palate. So it's definitely very important to go to someone who's extremely knowledgeable about the field and is able to help your children.
Yeah.
So
They say, what's the cure for sleep apnea? So why is everyone focused on the cure? They should be focused on prevention. And that starts literally infancy, from birth to about 6, 8 years old, when you can actually expand the palate and create the airway for a lifelong success. And by the way, those who snore, the reason is because you don't have enough space, and so your tongue is collapsing. This is all stuff that a pediatric dentist can do. So let's focus on some of the special population who have special needs. Where do they go? And how do you handle, maybe a patient with Down syndrome or other types of special needs? Can they bring them to your office? Do you have the specialty to handle those?
absolutely. So part of our dental training or pediatric dental training is to deal with special health needs children.
Hmm.
So it's a big part of our what we do and being able to help children. So for instance, if you turn 18 and you're a normal healthy child, we tend to graduate you out of our clinic or maybe sooner than that, just depending on your behavior needs. However, if it's a special health need child, we keep them for as long as they want to be in our
Wow.
part of our practice. So they become part of our family. So we get trained on these different um, diseases, diagnoses, different spectrums that children can be a part of, and we get ourselves very well acclimated with that. That we're able to help them with the proper ways. For instance, if a child is autistic, the way we approach them is different. The way my staff approach them is different than a normal child because the way
Mm.
they comprehend things is different. So you want to make sure whoever is seeing your kid is fully trained and equipped with the right tools to be able to help provide the proper care.
So pediatric dentists get specialized training on how to manage autistic patients, Down syndrome patients.
Absolutely.
This is not something generally that most dentists are trained on, correct?
Absolutely. Yes. I mean, with respect to my peer, of course, we got a lot of introduction to these special needs children. However, we tend to perfect that. We tend to become an expert in the field rather than
Mm.
just be introduced to it as being a pediatric dental residents.
That's amazing. So one of the things I wanted to ask you about with basically pediatric patients is also, how do you know when there's a problem? Like, at what age should you start to see teeth erupt, and when should you start freaking out?
It's a great question. So when it comes to teeth, they tend to it's a spectrum. It's not a set date. On average, around 6 months of age, the first front teeth tend to pop out, erupt naturally. However, my nephew has for one. Like there was a joke between our family. He was about 14 months and none of his teeth had come in. And our joke was dad's an orthodontist, mom's a dentist, and his uncle's a pediatric dentist. His teeth are afraid to come out.
That's funny.
But all jokes aside, he had his full set of dentition coming in, and it's perfectly normal for a child to be delayed. But if there's ever a true concern, we want to make sure we bring the kid in, take a dental X-ray, take a look at if there's something obstructing the eruption process, or if there's missing dentition. It could happen from time to time. So we're definitely bringing the child to the dentist or pediatric dentist so we're able to take the proper exam or diagnostic tools to give a correct
Evaluate 'em,
answer.
yeah. So there is variability, there's a range, but the
Abs-
general rule is take your baby to the dentist and pediatric dentist for them to evaluate it. I mean, at that point, we can evaluate for specific problems. So one of the things I wanted to ask you about is this about like thumb sucking, and just sucking on things in general. So what problems can this avoid? How do you avoid if someone is a thumb sucker or if they're just addicted to a pacifier for too long? What general guidelines and recommendations would you give for that?
Well, so the psychology of it is you don't want to get frustrated with the child. You want to make the child feel welcome. You want to be able to explain to them why we don't want it to do it. These kids are a lot smarter than we give them credits. And so seeing that, so prolonged use of those will lead to malocclusion, or it changes the anatomy of the palate complete. And so you want to be as loving, as kind as possible with the kid rather than getting frustrated with them. Try to give them alternative method. Like for instance, if it's a pacifier, there are different weaning off pacifier on the market that cuts the nipple of the passy gradually so the kid doesn't get the same suction effect, so they're
Mm.
able to come out of it. If they're finger sucking, you want to kind of gross them out about the germs that's on their hands. So, and it works, but it's just you got to be consistent.
So at what age should you say you know, probably suckers should start to be weaned off? Is it 2 years,
Two
3
to
years?
three, yes.
Okay. You hear that, parents? So no 6-year-olds with pacifiers. I've
I've
seen it. I've
I've
seen
seen
five,
it too.
6-year-olds. So what do you do? I've heard of people also um, thrusting their tongue forward and pushing the teeth out. Like,
Absolutely.
tell us about that.
So tongue thrusting is actually a huge issue when it comes to malocclusion and not having adequate spacing or even breathing issues. So
Mm,
we want to teach children how to properly position their tongue in the right place. There's a few different exercises that they can do. If there's a big issue that they can't do it by themselves, there is myofunctional specialists that could help the children to be able to better position their body and anatomy, and they could guide them through it. Of course, we can definitely be a source for that as well, but we work together in collaboration to be able to help the child to properly place their tongue in a position where they're able to breathe better, swallow better, and prevent the teeth from forward movement. So how orthodontics movement come about is consistent force, right? It doesn't have to be heavy force, just consistent. And the tongue is consistently pushing against these teeth and will cause them to become malplaced or malaligned.
So pop question. I like to ask my patients. I say, what is the strongest muscle in your body?
Absolutely, tongue.
Right? It's the
Yeah,
tongue.
that's
It's
the
great. It's
tongue.
not your biceps.
Pound for a pound is the tongue.
Pound for pound, the tongue is the strongest muscle in the mouth. So the children that have this tendency to put pressure on the back of their teeth, they literally will push teeth out of place. So I've seen a pediatric dentist start to train the tongue if it's a very bad case by actually putting something in the backside of the teeth. Tell us about that procedure. How does that work?
S- So that's it's a great tool to use. However, you need the child to be cooperative.
Hmm.
If the child does not want to themselves give up the habit, you putting an appliance in their mouth, they will either use their finger or the tongue itself to break these tongue cribs or appliances such as that. And then what it will in turn do cause TMJ issue because it will make your jaw grow you're putting up forces at places it shouldn't be. So you want to make sure you talk to your child properly, make sure they're on the same page as you are, and they're willing to and wanting to go ahead through with this. So it should supposed to be an aid, not actually something that's going to stop them.
Okay.
They
Okay.
gotta want to stop the
So it's
behavior.
part again, educating and
Education is the biggest key.
okay. So I want to shift focus on something I see in elementary schools, and some of these kids are smiling or not smiling because of the fact that they have all of this metal showing in their smiles. And so I see some of these young kids smiling, and all of their teeth are looks like metal crowns for teeth. I know you were mentioning how important it is um, for kids to have the confidence, and so you use when you need to do these things, you use a white colored restoration, so it doesn't make make the kids feel ashamed of smiling. Like, tell us about, when do you need these crowns in the first place? And then what are your options of materials that you use in your office?
Absolutely. So, when it comes to baby teeth are different than adult teeth, and
Okay.
how we handle them, the dentistry is a lot different than regular adult dentistry. So these teeth aren't built to last.
Okay.
They're meant to serve a purpose. An analogy I like to give my parents is like these teeth, think about them as your spare tire.
Okay.
Right, versus your regular tire. You can't beat up your regular tire, your spare tire, the same way you beat up your regular tire. So it's the same thing with these baby teeth. They're there for maybe 6 to 12, 13 years of life, and their purpose is to help our dentition to hold a place for our permanent dentition to come to replace them.
Okay.
So these teeth aren't, again, because of their anatomy and because of the way they're shaped, once they get cavities, we need to make sure we preserve the structural integrity of these teeth. So we can't always place filling in places where I could put it for yourself and I. So
Right.
it just doesn't work the same.
Right.
So sometimes we need full coverage restoration. And those stainless steel crowns, they're not my favorite, but they do work.
They protect the
They
teeth.
protect the teeth.
Okay.
Like, for instance, if a tooth needed a root canal, placing a filling on it, it may not be the best option because it
Okay.
can create more structural stress to the tooth, and they bite into something, it could fracture, or it could have leakage and bacteria gain access to the tooth again and cause more issues.
Wait, so children can get root canals too?
Absolutely. There are different kind of root canals, but they're not the same. So for myself, I don't do adult root canals.
Okay.
However, I do children's root canal. So they're just completely night and day difference.
So if the cavity's gotten so bad for your baby's mouth that the tooth is almost at risk of being lost, it's even infected, you can go in there as a specialist and clean out the decay, do a baby root canal, and then restore that tooth with a crown to protect it until the permanent comes out.
Absolutely.
It's
So
incredible.
yeah, so situation as such as that tooth that we're discussing right now gets root canal treated or baby root canal treated, then we need to place a full coverage restoration. Sometimes when obviously not my favorite choice, silver crowns, because as you mentioned, it does have to have a sometimes negative stigma, but you'd be surprised. I had kids come in there just asking for it. It's like, I want to be Iron Boy.
Oh, really? Okay,
So
they like it.
so it really depends on a patient. Some kids look at it as the coolest thing on the planet, and then other kids really are ashamed of it.
Do you give them an option? Like, can they choose to have this color, that color?
Absolutely,
Okay.
absolutely. We have different variety option. We have
Okay.
some that are just silver, or we have some that are silver infused with
With
white,
whites,
and
yeah,
some
yeah.
of them are just like yours and mine, zirconia.
Yeah.
So the options are vast as far as what it comes down to.
Okay, so you give them an option depending on what they want. So basically, some of these patients that you see that have baby bottle tooth decay, all of their teeth are just rotting. You can go in there and actually save all these and restore them back to life.
Absolutely. Absolutely. That's something that you actually want to do. So pulling these baby teeth, as we mentioned earlier, comes with a great cost. So as long as we're able to save it, we genuinely want to do everything we can to keep those teeth in the mouth. They said, what's the best space maintainer? Natural dentition. So if we're able to keep the tooth within the mouth, we prefer to do that. But unfortunately, it's not always a possibility.
So let me ask you a question. If you are a parent and the teeth are starting to get loose, why would you go and spend money at a pediatric dentist to pull the tooth? I mean, can't you just tie a little? I've seen on TikTok people tying strings. I've seen it when the old days they would close the door. I've seen now Nerf guns. Like, talk to me about that.
I'm a victim of one or two of those teeth because of my older brothers. My teeth did come out in those
But
fashion.
I mean, is that okay, or
No,
is it
it's not
dangerous?
okay.
Like,
Of course, we definitely want to make sure if there might be sometimes a tooth might be obstructed with something, or sometimes we can just let it fall out naturally. But we definitely, if there's infection, we definitely do not want that permanent tooth come into a environment that's just filled with pus, bacteria. You want to make sure it comes at a disadvantage at a a head start of trying to make
So
its
you
way through.
clean everything after you take the tooth. You make
If
sure
we
you
take
clean
out
it.
a tooth, we curettage the area. We want to make sure the environment's healthy. Yes,
Okay.
of course.
And then what if like a piece of that root breaks and like they may accidentally leave a piece underneath and that gets infected, right?
Well, great question. So with pediatric dentistry, it's a little bit different when it comes to adult dentistry. So if you leave a root tip behind in a mouth of an adult, it can potentially lead to a lot of problem. However, when it comes to our pediatric population, American Academy of Pediatric Dentistry recommends us not to go fishing around
Oh,
for
just
those
leave
root
it.
tips.
Okay.
Let it be. The body either will push out the root tip, or as the permanent tooth is making its way out, will resorb that piece of root tip.
Okay. So one of the things that one of the terms that I learned is mixed dentition. So this is the period between your actual baby teeth and your permanent teeth, or they're there at the same time. So you guys take X-rays and you can foresee years before the teeth actually erupt. You can see where they're going to come out and if they're going to get impacted. If the patient needs surgery. At what point do you start looking at this stuff?
We look at them from the beginning. So
Okay.
of course, we always want to monitor every single X-ray you take. You want to take everything within it seriously, because there could be so many different things you might miss if you're not taking things at its face value. So to answer that question, yes, we do tend to look at it once those permanent dentition are aligned. It kind of gives us, there are different studies that help us identify these, um, either lack of space or too much space, or missing teeth. So this will help us guide the parents as it comes to get a consultation with our orthodontist to make sure that their teeth are going to be erupting in the fashion that we want them to,
Okay.
rather than just kind of play guesswork.
And then do you work with any orthodontists like in collaboration to make sure that the teeth are coming out in the right way?
Of course, that's part of, I mean, that's a blessing of going to pediatric dentistry. So I'm fortunate enough and blessed enough to have my oldest brother be part of our team. We work together and we have that constant communication. Every single one of our patients is like a family member. So as we're sitting at dinner table, next thing I know, we're discussing, him and I were just like pulled away from the side from the whole family, just talking about our patient cases.
Now, I've heard a lot of dentists rave about your office and, just the fact that you have a very modern and technologically advanced office, how your patients are comfortable. I want to kind of see your office and see the environment you set up and, oh, look at that.
And that's
Who is
our,
this? Tell us about this.
So this is one of our patients, and he was actually very fearful of dogs, and he happened to come in, and Vader became his best friend. Now, when they come in, he literally lays on the floor, lets Vader go. Him and Vader are like best friends; they're inseparable. When he walks into the office, Vader literally greeting him at the door. He gets his scent, and it's over. I can't tell him. I cannot take him apart from each other. So having an amazing support animal to help us. There's
Oh,
just
that's
so
so
many
cute.
different kids that Vader has allowed to be comfortable being in a dental setting where previously were either traumatized or scared or whatever the case was. They no longer go through that. And having a therapy dog has helped us be that much more loving and caring, and be able to support our patient in the proper way.
Yeah, I mean, I don't know the amount of dentists that actually go through the effort, an extra measure to have an emotional support dog in their office, because I imagine that adds lots of variables. How cute. So when the dogs are playing with with the patients, they come in, they calm them down, and then from there they go once they're calm and get the treatment.
Exactly. Or sometimes they don't even want to walk into the office.
They're
And
so
then Vader
cute.
goes and goes, go ahead and brings them. I have patient who dress up literally just to come say, hey, look, I look like Vader.
That's so funny. That is so cute. They're adorable. So that's part of the process, is like making sure some of the staff I've seen, your staff actually dress up and are doing songs and singing,
Of
and it's
course.
just a whole all the preparation and the amount of patience that you have is just remarkable, really.
Thank you for saying that. But I'll tell you one thing about pediatric dentistry. It's given me one of the most it's very challenging. It requires a lot of patience, but it's the most rewarding field for me in the world. I find it at home because I used to be a scared kid going to the dentist. So I could have empathy for these children and understand what it's like to be terrified and being yelled at or not given the love that I needed rather than get shut down. So having the right staff, having the right technology, having the right support animal to be there to help us, all of this thing combined allows for a child to have a healthy mental psyche where they feel safe. So,
It's interesting. So a lot of the dental school applicants, a lot of the dentists that I've mentored or read their applications to dental school, they usually have something in there where, it says, like, I was inspired when I was younger. When you ask them, why do you want to be a dentist? Well, I had this childhood dentist who really inspired me, spent that extra time. And it was such a profound experience that they actually decided to go into dentistry. So it's really remarkable. It takes a special kind of person with a lot of love, a lot of patience, and it's just a character that I think you have, and I see in pediatric dentists. And how lucky are your patients to have someone incredible like you?
I'm the lucky one, honestly. They truly come make your day. They give you all the love in the world. It's pure love. They're genuine. And what you see is what you get. And what you get is a lot of love from these children. So, they keep you young. They keep you on your toes. So,
I'm sure.
I couldn't be more grateful.
Well, now knowing what we know about the fact that the oral health is a direct determinant of general health, is if you don't have good oral health when you grow up, this can actually cause things like cardiovascular disease, dementia, Alzheimer's. I mean, there's a whole list of diabetes. So these have a profound impact. And so what you're doing essentially by taking your baby to the pediatric dentist early on and getting them acclimated with dentistry, with good oral hygiene, with good oral health, I think is something that can actually save lives down the years. And so I wonder how much emphasis I think people put on that when they actually realize what your oral health can mean in terms of long-term general health. And really one of the things that I'm very focused on, I think I love the fact that we have had really engaging conversations about this, is the impact of oxygen. Just making sure that the baby is able to breathe properly. So a lot of patients, you were telling me, grind their teeth.
That's right. So grinding, it seems to be more of a common occurrence among, it's not normal by any means, but it's more common amongst children. Most children tend to grow out of it, but not all. And that's where it leads to more adult issues with their permanent dentition. That's why it's very important for us to try to catch that early on to see what the underlying cause is. And sometimes we see grinding, we think it's just normal. It's not. So we need to know, is there a breathing issue? Is there a tongue tie issue or some other anomaly that's causing this?
Sure.
So bringing them to a pediatric dentist will allow us to be able to hone into that and try to catch that as early as possible.
Well, I'm so happy to have you on. Thank you for coming. How lucky are your patients having an incredible team, staff, and a sidekick like Vader? I hope to have you on again very soon. And if people want to find your office and come see you, how do they find you?
Well, thank you so much for having me over here. It's a pleasure and honor to be in part of this podcast. And for our patient, we genuinely, our team and I believe that we're the blessed one to be able to provide and take care of our children. And in order for us to be found, right now, my office is in Montebello Children's Dentistry. And you can look us up on our website, or if you need, give us a buzz.
What's your website?
MontebelloChildren'sDentistry.com.
Okay.
Or you could reach us at 323-597-1195.
Wonderful. Well, thank you so much, Dr. Nasibi. It was absolutely a pleasure, and I hope to have you on. A true dental hero, and what a pleasure to have you.
Thank you so much for having me.